Hi everyone, this is Jack from BritAsia TV, and I'm very fortunate to be joined by Dr. Roopak Khara today. Hi.
Hi Jack, how are you doing?
I'm very, very well. What about yourself?
All good, yeah. Can't complain.
Keeping out of trouble?
Keeping it well, doing my best. I'm not working today. I'm back at the hospital tomorrow, so this is
that's right. So, Dr. Roopak is an adult psychiatrist down in London, aren't you?
Yeah, so I'm in West London, yeah.
From West London, so you've bravely come from where you were fighting fires and doing constant heroism to be with us today. Hopefully you've taken off your hero cape. And
it's really, really nice to be here. I'm a big fan of BritAsia and the outreach that you have, so it's real pleasure. Really nice.
The pleasure is ours, believe me, and mainly because it's about a cause very near to my heart. So it's about mental health, isn't it, and helping people during the pandemic. Because as we know, mental health problems have increased considerably, haven't they, during this? And people don't necessarily feel they have a place to turn, and there's a lot of mental anguish for a lot of people. There's uncertainty around their housing, perhaps their relationships, their job, and those three pillars are so important to our mental health, aren't they? And many people have lost them all simultaneously. So I think anything that people can do to improve on that is great. And I think the message is that the NHS is still very much open for business, isn't it?
Yeah, absolutely. I think that's the most important thing. It's difficult, isn't it? Because we've got these sort of this message that we need to stay at home, we need to reduce the risk of transmitting coronavirus, and that is absolutely the case. But I think if you've got healthcare needs and you are struggling, then I don't want people to feel guilt that they can't try and seek support that they need. And I think that's one of the key messages, that the pandemic, we don't know how it's going to continue to play out, but we do know that our health is not going to wait for that. So if something changes, we need to be empowered, I think, to seek advice and help when we can, because that wouldn't change, doesn't matter what the circumstances are.
Absolutely. And I think it's there are cultural factors at play as well, which make some of these trends worse. The stigma isn't there around, there's something wrong with me. It can be worse in certain cultures where it's, seen even more of a dim light, and people don't want to be a burden. That's another thing. Everyone's so busy. Oh, we can't do that, so we just kind of sit alone and stew and suffer. I said to you,
it's a very, very valid thing, isn't it? Because certainly with, I work in West London, so I cover sort of, Hammersmith, Southall, Ealing, that sort of whole patch of London. And one of the commonest problems that we have at work with patients is that they get put off seeking advice and support because English isn't their first language. And I think if you're having problems anyway and you're not comfortable to communicate in English, it's going to put you off even more. And I think it's important to highlight that there's a variety of different services out there that can help translate, doing a confidential translation or using interpreting services, so that shouldn't be an unnecessary barrier to people seeking help if they want to speak in a language other than English.
Yeah, that's a really good point, because when it comes to doing something different, some kind of change of behaviour, it requires some kind of activation energy, doesn't it, to get started? We need that lift, and that just makes the energy level required a lot higher, doesn't it? We know that when we start to do a change, we get momentum, it gets a lot easier, but making that initial change is incredibly hard. So I think that's a good point. Anything you can do to remove those barriers and tell people actually these things are there for you. So just tell me a bit about how people could go and access these therapies. If I wanted to, how would I go about it?
Yeah, so I think the most important distinction to make is that I think a lot of people worry that they have to have a diagnosis, or they have to have a condition about their mental health in order to seek something like talking therapy, for example. And that isn't the case. Anybody, as long as you've got a registered GP, you can refer yourself to something like talking therapies. It comes under this term of IAP, which some people may have heard of, which stands for Improving Access to Psychological Therapies. And it's an umbrella term for lots of different means of support for people, lots of different talking therapies for lots of different things. So I think if you wanted to pursue it, you can refer yourself, and you can do it online. on NHS website, or if you want to speak about it with your GP, they can also make a referral on your behalf. So the route of referral is purposely made as easy as possible to improve people's chances of choosing to pursue it. So if you want to do it yourself, you can do it online, and it's fairly easy to do.
Yeah, and that's really good to know, because again, people do feel like it's a burden or anything to do with it being unknown. People don't go and do it. But I think it's really important that you say it isn't just people that have these mental health problems, because these problems can creep, can't they? That they don't leap. It's very insidious. And before we know it, we're actually struggling. And we're not taught how to deal with these emotions and feelings that we have. Nowhere in school teaches you any of that stuff. And kind of the more academic mastery you build up, the worse you seem to get at that kind of thing. From my point of view, when I got to 24, I'd achieved everything I thought would make me happy. I'd got the credentials, I'd got the body, all these things, the prestige, all these things that we think will make us happy. And I realized that I was utterly miserable. Right. And when you reach that realization, it forces you to look at everything again. And I realized it wasn't my ability to think that was the problem. Medics can do that very well. We can think well. It was my ability to not think. I couldn't turn off that overthinking, overanalyzing mind. And over time, I started to pick apart my very soul. And I think a lot of people are in that kind of situation, particularly in the pandemic, because the reason why so many of us are busy, whether we know it or not, is because we don't want to sit alone with our thoughts in a room.
Well, that's just it. It's such a, you hit the nail on the head, because I think it's one of the commonest, I suppose, difficulties I think everyone faces, is that when you're going through a difficulty, or you're experiencing something that's bothering you, we tend to do this, this very, very natural thing where we think, while other people are worked off, you try to put in context your problems compared to other people. And, it doesn't matter what the difficulty is. You could be someone who's managed to work through the pandemic, but you're having problems at home. You could be someone who has lost your job, but actually you're enjoying spending more time with your children at home. There are so many different things. And I think the experience of being distressed by those kind of feelings should be validated. It shouldn't be the case that you think, well, actually, I feel bad because I'm still working and some people aren't. Because actually, if something is bothering you, it is bothering you. And as you quite rightly said, there's no amount of sort of overthinking or trying to put logic to that that's going to make us feel any different. And that shouldn't be a barrier. You and I are both doctors. We have been lucky enough to sort of continue trying on with work through the pandemic, but we've still got the same worries as everybody else. My family are all doctors. I worry about their health when I'm going to work. It's driving me a bit crazy being not being able to see your friends and family and that kind of thing. So I think it's important to recognise that difficulties are going to affect different people in different ways, and we need to make sure that we recognise the importance of that.
Absolutely. And I think, we don't all wake up one morning and think, oh, today I'm going to be depressed. Again, it creeps, doesn't it? And, so much of what we think and how we feel become habit loops, don't they? In a part of our brain called the basal ganglia. So the brain goes, oh, great, Jack is thinking this on a regular basis. I'll make this nice and easy for him. So he's got the best of intentions. But then the trouble is we get triggered by familiar environments, situations, the news, your spouse, arguments that trigger us down that autopilot again. So with the best will in the world, these things are hard.
Well, that's the thing, it's well, that's exactly what it is. You kind of, that's one of the subtleties about mental health. And I think that's the way we can show respect to how unique everybody's mind, everybody's mental health is. Is that there's no, you're exactly right. You don't just wake up one day and think, actually, I've got these kind of symptoms and I feel this way. This is something, when it comes to mental health, a lot of these things creep up on you over time. And the best thing you can do for yourself is to do everything you can to put yourself in a position so that you're less likely to be affected by that. And it's not easy to do, is it? I mean, given the fact that we're all pretty much at home, given the fact that we've got this continuous loop of information, everything is related to the pandemic in one way or the other. It can be really difficult to switch off and get any sense of perspective.
It's inescapable almost. And then when you bring in the ills of things like smartphones, right, that they are a habit forming product. They are made to be addictive. There's a trigger, which is your notifications, which then you respond to, and it gives you a nice hit of dopamine, makes you feel good, and then you get a reward, which is a like, and then you invest your details, by having a big friends list or whatever that might be. So people are also addicted to their phones.
Yeah, it's a difficult balance, isn't it? Because some of the resources that we advocate, sometimes we say to patients, if you look at some, they might want to look online for some advice about mental health and that kind of thing. Sometimes there's resources about talking therapies that we might say, have a look online and see what you think. And on one hand, we're saying, have a look online. On the other hand, we're saying, well, actually, if you spend all day on your phone, it's probably going to impact on your mood. And it is a delicate balance, and it's not easy to get it right, is it? I think it's one of those things about trying to keep a sense of balance, I guess, and trying to limit or moderate how much you're using.
It's a really double-edged sword, isn't it? But I think you need a lot of self-awareness to realise these things are happening. So I realised, okay, I've got the academic know-how, and I'm also very driven and very determined, but I'm still pulled in by a smartphone. Yeah. It's all shiny. We can't help it. So it really.
Well, it's a form of connection to the outside world, isn't it? Because we do pretty much everything on your phone. You can order things, you can talk to people, you can watch films, you can do all sorts of things. So it's a very delicate balance. I think trying to keep that in perspective in time of pandemic is really difficult. And I think it's one of those things where it can sometimes alert you to the fact that things aren't quite right. And I think that's where it's important to think about something like talking therapy, because actually you might not in your mind have a concrete fixed idea of actually this is what I'm struggling with. It might just be, I don't feel myself and my mood isn't as good as it used to be, or I'm feeling quite anxious about things, or I feel like I'm not coping with something. It doesn't have to be something concrete. It can just be, I feel like this. And that would be all that you would need to have a think about using something like talking therapy, because it gives you a sense of perspective. It can help you understand, okay, why do you always have to use your phone? What do you get from it? How do you feel when you use it? How's it impacting on your mood? And that can help in the long term, because as we all know, there's no deadline for when this pandemic is going to end. And I think that's something that we're learning to cope with every day. We just don't know.
I think talking therapies are even more important now, because we should learn to, when we have a problem, go to our loved ones, go to our friends, right? So on the one hand, we're increasingly going to a device because it gives us dopamine, which numbs our pain of whatever it is we're experiencing. But then also, we might not necessarily have those friends and family in proximity to us or whatever. We can't get that catharsis. So, I've heard said before that going to see a doctor in itself is a medicine. Yeah. The actual doctor relationship, it doesn't have to be a doctor, it can be any kind of medical professional. That catharsis is extremely useful. Even if you don't talk about anything in depth, it's just getting it off your chest, isn't it?
Absolutely, it is. And it's a very good point about family and loved ones, because some people don't have access to that. We always just say, speak to your loved ones, speak to your family. But coming from and working in London, there are a lot of people that I work with that don't have anybody. And also there's a downside to that, because by virtue of people being your loved ones, you might not necessarily want to talk to them about difficulties in mental health. You might not want to burden them, or you might want to get someone who doesn't know that background about you to give you a fresh sense of perspective on things. And I think we make the assumption that it's good to have people around you that you love and trust. But as we all know, when you're in lockdown, or even if you're not, you can still argue with members of your family and loved ones. They still might be contributing to the problem, and that's a sensitive area. So maybe it's not always the best thing to think, well, actually, I just need to speak to my family or friends. It's always good to do that if you can, but if you feel like actually this is something that I feel is quite sensitive, and I don't necessarily want to talk about it with my friends and family, that's equally understandable.
So people think that talking therapies is just for, like we've said, if you've got anxiety or depression. So it'd be useful if you could tell people, the broader extent of what it does help with.
Yeah, so essentially it's, as I said, it's something called IAPT, which stands for Improving Access to Psychological Therapy. and essentially it's an umbrella term for a different sort of resources and talking therapies for people who are experiencing pretty much any difficulty in their mental health. It could be, for example, people are worried about coping, people are feeling very stressed, people are feeling quite low in mood or depressed or feeling anxious, or people are just sort of struggling to cope altogether with the pandemic or anything else. And what it is designed to do is to work with people who use the service to identify what those problems are, what their perspective is on it, and to help equip and empower them with tools to maybe rethink what is going on so that they feel like they can cope better. And there's lots of different types of it. I mean, it's a huge sort of area that we can think about, but it does include, for example, things like online work. It can include some things like self-guided work where you've got some supervision from one of your therapists as to what to do about things, and it can also include things such as weekly work with a therapist, something like CBT. It's a very good form of therapy. It stands for cognitive behavioural therapy, and essentially it's sort of work with people to examine why they have sort of certain automatic thoughts about things that can sometimes be negative, and it just challenges that way of thinking, which can be quite helpful in the long term. So there's quite a few things that's well worth having a look online, but essentially, the main point is that there is something that can be tailored to what your needs are. So I think it's important to note that actually whatever the needs are of the person who's approaching the service, we will tailor something to suit what they need.
But tailoring is a very, very important thing, and I like the fact that you get the meetings with the professional, but then you also get some self-guided stuff, because as we know, you seeing a mental health professional or GP is 0.0001% of your life. Yeah. What happens in between, you need to be given those tools. So that's a really good combination. So let's say I want to go for it, and I think yes, I definitely need this, and I think I might do. So I might be speaking to you later on. What does someone go and do if they want to refer themselves? You said about it online.
Yeah, so you can do it online. Essentially, the website is nhs.uk/talk, or you can just Google it on the NHS website, and it's a fairly short referral form. You can give a rough idea of what you want to achieve with it. What happens after that is you get contacted, usually on the phone, by one of the practitioners under the service, who will use that time to explore with you what has led to the referral, what is it that you're currently struggling with, what is it you'd like to get help with. And that sort of kickstarts, I suppose, a goal or an idea. And I think it's important to say that a lot of feedback I've had from patients certainly is that they say, well, I want to refer for IOPT, I want to refer myself, but actually I'm not sure what goal I have, I don't know. That's okay. I don't think you have to go there with this preformed idea of what you want to achieve from it. I think you just need a willingness to engage with what is offered. And I think if you're able to describe what difficulties you're facing or what's bothering you, that is enough to go on. So I would say don't worry about having this sort of idea about things. You don't need to have one, and I don't think anyone can expect you to have a really well-formed idea of what you want to achieve when you're experiencing distress in some form or another.
I think it's having that acceptance and awareness that something isn't quite right. You can't change anyone unless they've made that acceptance or that decision, can you?
Absolutely.
You can say, I'm going to help you lose 3 stone. And you might know all the stuff, you might know all the content and be brilliant. Yeah. If they don't want to, it's pointless, isn't it? And it's exactly the same with mental health. So let's talk about how COVID has impacted the nation's mental health then. So it's been severe, hasn't it? There's been, anxiety has increased to, 50%? At the start of the pandemic, and depression is about 20%. I mean, it's scary.
Yeah, absolutely. Really it's scary figures, and I think it kind of mimics the whole difficulties about mental health in the first place. When this pandemic first started, there was, the main focus was on, immediate treatment, people becoming acutely unwell with coronavirus. Quite rightly so. Nearly a year later, what is the biggest problem that we're facing is this huge backlog of what's happened with our mental health, and it's exactly like you were saying before about leaping and creeping. It didn't leap, it wasn't on the forefront of our minds when the pandemic first started about thinking about our mental health, But a year later, that's probably the biggest thing that we need to be thinking about. We know from the beginning, obviously, this is something that was going to affect everybody. And I think what we know now with a lot more detail, that it's affecting people in very different ways. I think it's important to acknowledge that, it's not good enough to say, actually, we're all in this together and, we're all affected by the pandemic, because we know that there are certain groups of people, that are experiencing the pandemic in very, very different ways. And we need to make sure that we are tailoring and reaching out to those people who are vulnerable. I recently was working on a ward, a mental health unit, where we work with patients who've got serious mental illness, who have contracted coronavirus. We were looking after them and working with them whilst they were, on the unit with us. And it's a challenge in itself. You can imagine if you feel like your mental health is good and you're watching the news and you're seeing what's going on, even if you don't have mental illness, it's going to impact you. It's going to be on the forefront of your mind. It's going to be there all the time. And I think it's important to make that distinction, that we're not specifically talking about mental illness. We're talking about mental health. Not everybody is going to have mental illness, but everybody has got mental health. They've got mental health, they've got mental well-being, and I think that is what we need to be focusing on.
And because stigma away, isn't it, as well?
Yeah, absolutely. And that's the thing. Yeah, you're right. That's exactly it. Because I think it is something that tends to still have, some people still are quite reluctant to seek help for mental health, or to say they want to seek help for it. But actually, sometimes, we've had people that we've worked with who have declined. They said, look, I don't want to get any help because I don't want to be seen as having mental illness. And I said, well, do you want to have, would you like to say you've got mental well-being or mental health? They said, yeah, absolutely. I said, well, there you go. I think it's about reframing how you approach your mental well-being and mental health.
Reframing.
Because that encourages, exactly.
In every sense, that the lens through which you see the world changes your world, doesn't it? Perspective is just so important. Yeah. And I think it's important to know that it's okay not to be okay, and that's always true. It's even more true now, because just the baseline of getting through the day is a lot tougher, isn't it? The whole baseline has been ramped up. Even just getting through the day today is now 40-50% tougher. I mean, it's hard to quantify that. It's different for different people, but it's my hope because there are so many trends that were just on a relentless downward decline, weren't there? Mental health being one, social care being another. There were so many things, environmental problems, pollution, and that was only going one way. So it's my hope that this pandemic shines a very bright torch on some of those issues, which I think is happening to a good extent in terms of.
Oh yes, absolutely. That's exactly what it is. You're right, because I think it's I think that's one of the key things about mental health, isn't it? Is that it's affected so much by so many different things. It's affected by the environment. It's affected by your social and economic circumstances. It's affected by your ethnicity. It's affected by so many different things. And I think I'm glad that there's more detail coming out about that, because that's where the bulk of it is. We need to make sure not only that we look after people now, but actually we need to be thinking ahead. Once this pandemic, the sort of arbitrary deadlines for social distancing and that kind of thing are done, we're still going to be left with this burden or problem of people who, for example, weren't able to have the big wedding that they wanted, people that weren't able to mourn in the way they wanted after somebody and their family passed away, and they couldn't go to the funeral, or the teenagers who haven't had the university experience that they wanted, people who've had exams cancelled, people who've lost their jobs. And I think it's that kind of foresight, to think this is what we are heading towards. What are the subtle differences we can make to people's mental well-being to make sure that they are
absolutely
mentally as strong as possible?
I do worry about the legacy cost of this. Is it going to change the very fabric of so many facets of our life? And I'd argue, yes, it probably is. So we've got to try, and broadly, change happens in anything when the pain of changing is less than the pain of staying the same. If you're not in enough pain, you don't do anything about it. You just kind of stay, unhappy, whatever. That certainly was true. I was so miserable, I had to change it. Is this going to provide the environment where we have to look at stuff again? We have to suddenly address our mental health. We have to address Black Lives Matter and environmental issues, all these things. I think all of that is true, and I guess that gives me a bit of enduring hope that, you know, what we've had to endure here will actually have a legacy that is in some way positive. But yeah, so can the NHS actually cope with a potential influx of new patients?
Yeah, I mean, we know that the demands of the NHS are going to be, they're always going to be there. I don't want that to put people off, because I think one of the many great things about NHS is its ability to be responsive. And there's been a change in how some of the talking therapies and services provided by app have been delivered in the pandemic. So, for example, there have been more resources made available online. There's availability to do video consultations or telephone consultations even. So the type of work is still there. The format in which it's delivered might have changed slightly. So that shouldn't put people off from trying to seek support from that if they need it. We're just using a different format compared to what we might have done if we were not in a pandemic.
Yeah, absolutely. And, you know, certainly within like medical school and, you know, the wider working world, there's this belief, isn't there, that, you know, we're kind of untouchable and you know, we don't need support, and, you know, it's our own well-being is sidelined and you can't speak out about these things. So in many ways, doctors and nurses are struggling just as much, if not more, with what they're having to endure. You know, we haven't got all the answers figured out.
Yeah.
So it's trying to normalise that things are really.
Yeah, absolutely. Yeah, it's so true. It's a very valid point. It's yeah, there's about 1 million of us working in the NHS in some form of capacity, and I think it would be really remiss of us to say, well, actually, you know what, we're working, and you're just, you know, we don't have any difficulties with it or anything like that. It is going to affect you, and I think it's that compassionate side of you that drives you to have a career in the NHS in the first place.
Yeah, absolutely.
It's going to make you feel like that. I certainly feel it, and I will freely admit that. I've been working pretty much every day throughout the pandemic, you know, at the hospital, doing lots of sort of extra on calls and things, and you love your job, but at the same time it's so frustrating because you can't do the same things to refresh yourself outside of work. You can't do the same things with your patients that you would normally be able to do, you know, and especially patients who are having difficulties with mental health, they're suffering from acute mental illness. It must be even worse for them. And I think it's important that we recognise that difficulties in mental health and well-being are universal. It doesn't matter what you're doing, work-wise, it doesn't make a difference. It is something that unifies us all. And yeah, I'll be the first to admit it is particularly challenging. Of course it is. And I think it's something that brings us all together, even if we're working in the NHS or not. You know, the struggle is there, the difficulties are there.
Yeah, and I think you're totally right about, you know, being compassionate. It makes things more tricky in these kind of ways, because you want to help everybody, but you can't, and you end up absorbing people's problems, whether you want to or not. You need a lot of training to be able to deactivate that. I haven't got that level of training by any means. And then you start to think, oh, you know, if I'm not like that, does that make me a bad person? So I think amongst medics and nurses and other mental health professionals, that is a big thing. And I think, you know, we're even seeing some cases of PTSD, aren't we, related to COVID?
Yeah, I mean, it's on the rise for sure. I think there's a lot more concern these days about burnout, people's ability to feel like they can continue working. And it's one of those things where I feel like, you know, as a psychiatrist, I can't say, you know, advocate, you know, with patients that you will help you to do something there without first accepting that actually I'm just the same as everybody else. And, that's and I think that's really important, isn't it?
Well, you know, I spoke fairly openly about my difficulties, and I find that when you're willing to be vulnerable, it's amazing how people open up to you. And I think if you're in a position of perceived power and you have academic expertise and you are willing to be a little vulnerable, it's it's the 1-2 punch to get people to change things, isn't it? They're like, something about it really resonates with us. So kind of admitting that we're struggling, and it kind of gives other people permission to do the same, doesn't it?
Yes, of course it is. And sometimes that's all you need. You know, really, I think we don't want that. We want to be working to reduce those barriers that stop people from acting.
Yeah, absolutely. Yeah. I mean, amongst certain cultures, you know, more prevalent amongst men, you know, a bit more prevalent.
Absolutely.
It's because we have this stiff upper-lipped culture, you know, stoic, it's weak, right? You know, and very, very good friend of mine, actually, who was practicing as a medic, he committed suicide back in May. And nobody knew he had mental health problems. And this was a really big guy, 18 stone rugby guy. And if you asked anyone in the med school who would be the two least people least likely to suffer from mental health problems, they would have said me and him. Yet we both suffered from it quite badly. You know, and I suppose when you are of a big build or you're seen as masculine, you feel even less like talking about it, don't you? And it becomes almost identity as well.
Of course it does. Yeah, and it's you know, I'm really sorry to hear that. You know what you're mentioning about men in particular is you're absolutely right on the money. I mean, it's one of the things about, you know, talking about things. You know, we have this idea that men might not necessarily be as open about things or be afraid to show emotion, and I always challenge that, because I think there are some people I work with who we have our appointments and I don't particularly expect them to say much. I don't particularly expect them to open up or get particularly upset about things. But it's just the effort that they have made to actually seek the advice, to actually come for the appointment, to actually make the referral for something like talking therapies. You know, I think that's some of the work that's done right there. And it's scary, isn't it? Because it's always the last person that you would expect that would suffer with problems with their mental health. But actually, I think it's telling that it just goes to show how we can all be affected in different ways.
And another thing that comes to mind is another good friend of mine from med school. He's from an affluent background, a well-off background, and he suffered from mental health problems. He said, "I'm not allowed to have depression because I'm wealthy." And that's another element, isn't it? You know, some are seen as being more entitled to have mental health problems than not, which is...
Yeah, you almost try to rationalise it, don't you? They will actually know you're not. Yeah, it's so true. It's trying to rationalise it,
When people always say to me, like, "Oh, you've done so well, you're so driven, so determined, you come from a bad background, how have you done it?" So, yeah, monetarily, geographically, it might have been a bad background, but my parents loved me, you know, and that's far, far more important than kind of what we're surrounded with. But whereas he felt he didn't necessarily have that support, but he did have lots of money and, you know, nice trips. It's not the same, is it? It's not the same.
Yeah, it's true. It's one of the things I think is it's really important, because you tend to rationalise things, don't you? Especially when it comes to depression. We go, well, actually, look, you know, I've got a roof over my head, and, you know, my parents went through this, that, and the other, and I didn't. I've got no right to do like that. Right? I would always sort of respectfully challenge that and say, well, actually, you might be saying this because you're feeling low. And I think there's something about putting how you feel in the context of the times that you're living in. So fair enough, you might not have the challenge of not having a roof over your head, or you know, having to escape from you know, war-torn countries, or something that your parents or, you know, predecessors might have gone through. But actually, you're in a different world where there's a huge pressure on your image. There's a huge pressure on sort of social media. We've got environmental concerns. We've got political concerns, particularly what's going on in America at the moment. So I think that shouldn't ever negate how you feel, and I think it's important to recognise if you are feeling low, you're feeling down about things, it's in the context of your time, you know. And I don't think it's fair to try to rationalise it. And I suppose it's an automatic thing, isn't it? You always go, well, actually, no, someone else is, and I shouldn't. But why? If you feel a certain way, you feel a certain way. You don't need to rationalise that. It's an experience. It's an emotion.
Absolutely. I think as a culture, and certainly in the Western world, we need to change our focus away from going for the money, the power, and the status, and prioritise your moment-to-moment emotional state. Because if you don't, nothing you gain on the path forsaken that will have mattered. Yeah. And that's the truth. You know,
of course it is. Yeah,
I had the credentials, I had the physique, still utterly miserable. But when I started to prioritise my moment-to-moment emotional state, everything changes.
It makes a huge difference, doesn't it? Yeah, well, that's the thing, because it's such a universal starting point. If you start with your mind, when you look what we're using our mind to do, we're using it to choose a partner. You're using it to see what you like to buy, what you like to eat, what you like to watch on TV, what your job goals are, that kind of thing. It's such a universal route, isn't it, from which so many other things come. So if you can address that and make sure that is in as good a state as possible, you put yourself in a good position, haven't you, for other things that are
Absolutely.
going on.
I think we've still got some work to do in that, it's very much normalised to go and train your arms or train your legs or train your chest, train your physical body. Yeah. But we don't go and train our minds in the same way. You've got some disruptive apps like Headspace that are, making good progress, and I support anything like that actually helps. We're not quite there yet, are we, in terms of our perspective of...
Yeah. And I think what you were saying about how there's been this forced sort of introspection given the pandemic about mental well-being, I think that is something, to take a positive away from this is to capitalize on that. Because whether or not, whether we like it or not, it has been brought to the forefront of everyone's mind. And I've worked with patients who said to me before the pandemic, they didn't believe mental illness existed. They said, we don't believe in it, we don't think it's real. And then they said, look, when the pandemic happened and I was forced to stay at home with my family, I couldn't go out, couldn't go for a beer, couldn't go to work. They said it changed so much because I experienced a fragment of what it's like to not feel like your mental health is as good as it should be. And I think that is what we are working to capitalise on. And to put us in a good position to do that, we've got things like IAPs and Talking Therapies, we've got things like some online resources to put yourself in a good position so that you can minimise any future problems and learn tools and things that can support you for the rest of your life. And that's what it's primarily about, isn't it?
I think as a society, it's just trying to leave this truly dreadful time with something that could actually put us on better footing. And it sounds like, with what you guys are doing and the NHS are doing here, it is a very, very good initiative. I do hope people take it up. I mean, so is there anything you'd like to round off with?
Just wanted to say that it's I hope that people can use the take-home methods of actually, I know we're in a pandemic, I know that we've got lots of that kind of thing, but if you find that you are struggling with your mental health or your mental well-being, there is help out there. And I think please don't worry about not having a sort of good idea about what you want help with. It's just communicating to us that for some reason you're not coping or something is going wrong. There's a variety of different ways you can do that. You can speak to your GP, speak to your friends and family, have a look online about IAPs and psychological therapy. There's a lot of resources on there. So there's a sort of variety of different ways to get help if you need it. And I hope that in the course of our discussion, we've hopefully dispelled some of the barriers that I think stop people from getting help. What I will say as the last thing is, as a psychiatrist working in West London, I will say that I have been working with patients from pretty much every end of every type of person you can imagine. There's not one type of person who would come and seek help for mental health. People who've got absolutely no money, millionaires, people from different countries, backgrounds. So it affects everybody. So please don't let that be a barrier to receiving support if you need it.
That was very eloquently put. And what I found is, yes, all of you guys are incredibly skilled and talented, but you also really, really care and are really compassionate. So I think the two together is vital. And it's for you and for all of the staff. It's a trait that you see time and again within psychiatry. You have to be that kind of person. So please do come forward.
I think people just don't. I think they tend to worry about. They often say, "Look, we don't want to burden the doctor. Why would they want to know about it?" I can tell you firsthand, as a psychiatrist, I absolutely love it. I love getting to know people and patients, their stories, their backgrounds, their difficulties. That's the biggest reason why I became a psychiatrist in the first place. So that shouldn't ever be a barrier, because they want to see you. They want to understand you and to get to know you. So I think it's important to get that across to people so that they don't feel like it's
absolutely. And I think it just exudes out of you. So I think you've more than proven that point. But it's been really wonderful to speak. Although it was difficult topics at time, I think it's good to speak about these things again to raise more awareness and be a little vulnerable. But yeah, it was an absolute pleasure, and I hope everyone watching found it useful.
It's really nice to talk to you. All right, take care, everybody.
See you.
Bye.